Hello, everyone. I would like to thank you for joining us for this month's webinar. Our topic is Understanding Thyroid Problems, the Basics. And our presenter this month is Terry Somerville, and she's an RN and a health coach with Strategic Health Services. Terry?
Thank you, Dawn. As Dawn said, I am a registered nurse. I have 28 years of nursing background. Most was in adult critical care. I did do some pediatric special care nursing before I came to join Strategic Health Services as a health coach. And one of the things I have enjoyed in every aspect of my career has been the important part of education and teaching and helping people understand some of the problems that we're faced with. So with that being said, I'd like to start this month's webinar on understanding thyroid problems. I hope you all walk away with some extra knowledge that you didn't have. So generally, what is the thyroid? We're going to cover disorders of the thyroid, some of the signs and symptoms, common causes, common treatment options, and self-evaluation. So what is the thyroid? The thyroid is a part of our endocrine system, which is made up of glands that produce and secrete hormones in our body. These hormones help regulate our body's growth, metabolism, sexual development, and function, and they're released into our bloodstream and may affect one or several organs throughout the body. The thyroid is a small, butterfly or bow tie shaped gland. It's situated at the front of your neck, just below your Adam's apple and just above your clavicle or your collarbone. Hormones are produced by the thyroid gland, triiodothyronin, T3, and thyroxin, T4. They have an enormous impact on our health and affect all aspects of our metabolism. They help our body maintain the rate of which we use our fat and carbohydrates. They help control our body temperature. They influence our heart rate and help regulate the production of proteins. Now, some of the things I'd like to cover is hyperthyroidism, hypothyroidism, and thyroid cancer. So basically, hyperthyroidism results when the thyroid gland produces too much of thyroid hormone. In direct contrast, when you have hypothyroidism, this results when the thyroid gland fails to produce enough hormone. Now, cancer refers to any one of a large number of diseases characterized by the development of abnormal cells. These cells divide uncontrollably and have the ability to infiltrate and destroy our normal body tissue. Thyroid cancer occurs in the cell, of course, in the cells of the thyroid. Now, to go on, I'd like to discuss hyperthyroidism. There are several types of hyperthyroidism: Graves' disease, toxic adenomas, subacute thyroiditis, silent thyroiditis, postpartum thyroiditis, and ingestion of excess amounts of thyroid hormone. With Graves' disease, there is a release of excess hormones. It's triggered by an autoimmune disorder. The reason is unknown, but with Graves' disease, the body attacks the thyroid and causes it to spill out too much hormone. This can affect anyone, but is much more common in women under the age of 40. Toxic adenomas are nodules or abnormal growths that develop on the thyroid gland and secrete thyroid hormones, upsetting the body's chemical balance. Some goiters, or these growths, are abnormal enlargement of the thyroid gland, may contain several of these nodules. Now, with subacute thyroiditis, it's a painful inflammation of the thyroid, which causes the thyroid to enlarge and leak excess hormones. This results in temporary hyperthyroidism and usually resolves spontaneously. Subacute thyroiditis generally lasts from a few weeks, but may go into a month or so. Silent thyroiditis is usually a temporary state of excess thyroid hormone release causing a mild hyperthyroidism. In some cases, it can result in permanent damage to the thyroid and low hormone production by the gland. Now, with postpartum thyroiditis, it occurs in a very small percentage of women within months of delivery and usually only lasts a few months. It's followed by several months of reduced amounts of thyroid hormone production by the gland. And typically these women have a full recovery of normal thyroid function. Now, with Graves' disease, just to regress a little bit, the primary treatment goals are to inhibit the overproduction of thyroid hormones and lessen the severity of the symptoms. Signs and symptoms affect women 5 to 10 times more often than men, is most common in people younger than 40. Symptoms include sweating, rapid heartbeat, feeling hot, weight loss, feeling hyped up even at bedtime. You can even have eye problems. Hyperthyroidism is easily treated and can lead to a healthy life. Without treatment, hyperthyroidism can lead to a serious heart and bone problems and can lead to a dangerous condition called a thyroid storm. Now, I wanted to discuss thyroid storm or thyroid toxicosis on its own because this disease, if left untreated, is most often fatal. It is extremely rare in children, and it often occurs during thyroid surgery. The clinical presentation includes fever, tachycardia, high blood pressure or hypertension, neurological and GI manifestations. Diagnosis is primary clinical as there are no really specific lab tests available. It's commonly observed during thyroid surgery, especially with adults and older children. But improvement in pre-op testing has decreased the incidence of this complication, and it's seen now more as a medical crisis than a surgical crisis. With thyroid storm, it's a decompensated state of thyroid hormone causing induced severe hypermetabolism that involves multiple systems. The clinical picture relates to severely exaggerated effects of thyroid hormones due to an increased release with or without synthesis. Signs and symptoms of a thyroid storm: heat intolerance, diaphoresis, extremely high metabolism, mild to moderate sinus tachycardia that can intensify to accelerated tachycardia. And then when the heart starts to decompensate, can lead to cardiac arrhythmias, most commonly ventricular tachycardia or atrial tachycardia. And with those kinds of arrhythmia, once your body starts or your heart starts to decompensate, that can lead to death. Hypertension, where you have a hypertension crisis, your blood pressure goes sky high. Delirium, which is an onset within a short amount of time. You have poor thinking skills or disorientation. Behavioral changes. People have hallucinations. They're restless. Emotional disturbances. They have fear, paranoia, anger. Agitation. That's a part of delirium. And this can progress to seizures and coma. GI manifestations, diarrhea, vomiting, jaundice, and abdominal pain are often seen. Now, precipitating factors for a thyroid storm are sepsis, surgery, and anesthesia. Radioactive iodine therapy drugs, excessive thyroid hormone ingestion, noncompliance with antithyroid medications, diabetic ketoacidosis, direct trauma to the thyroid gland, and enlarged thyroid gland are often causes. In children, it's most commonly associated with Graves' disease. So now we're going to go on to causes of hypothyroidism. Hashimoto's thyroiditis, exposure to excessive amounts of iodine, radioactive iodine treatment for hyperthyroidism, and lithium, a drug also linked to the cause of hypothyroidism. Now, Hashimoto's is also an autoimmune disorder in which the body attacks the thyroid tissue. Now, I want you to understand that with our immune system, since this is an autoimmune, our immune system protects us when something such as a cold, virus, or a bacteria tries to invade our body. It identifies the bacteria or virus and attempts to eliminate it. But sometimes problems with our immune system cause it to mistake our body's healthy cells as invaders or bad cells and repeatedly attacks them. And that's what an autoimmune disorder is. So that's why you see the body attacking healthy thyroid tissue. And this tissue will eventually die and stop producing hormones. Amiodarone, or a heart medication, may cause exposure to too much iodine. And radioactive iodine treatments for hyperthyroidism, as I said, also can cause hypothyroidism. Lithium causes problems because it has an increased thyroid iodine content, which inhibits release of T4 and T3. It also can cause goiter formation. Some of the signs and symptoms of hypothyroidism vary depending on the severity of the hormone deficiency. But in general, any problem you have tends to develop slowly, often over a number of years. At first, you barely notice the symptoms of hypothyroidism, such as fatigue, weight gain, or you may attribute them to getting older. But as your metabolism continues to slow, you may develop more obvious signs and symptoms. So let's discuss some of these symptoms. Fatigue, increased sensitivity to colder. You feel cold when everybody else is hot and sweating. Constipation, dry skin, weight gain, puffy face and hoarseness, muscle weakness, elevated blood cholesterol levels, muscle aches, tenderness and stiffness, pain, stiffness or swelling in your joints, heavier than normal or irregular menstrual periods, thinning hair, a slower heart rate, depression, and impaired memory. Now, approximately 25 million people suffer from hypothyroidism, and about half are undiagnosed. Older adults, and particularly women, are more likely to develop hypothyroidism than younger adults, and it tends to run in families. Common causes of hypothyroidism, there are a number of causes, including autoimmune disease, treatment for hyperthyroidism, radiation therapy, thyroid surgery, removal of the thyroid, and certain medications, as I mentioned, such as amiodarone and lithium. And amiodarone exposes a person, as I said, to too much iodine. Treatment options are pretty simple. Treatment is for hypothyroidism is usually just thyroid hormone pills, such as levothyroxine or Synthroid. Treatment with medications tend to have quick relief from the symptoms. You'll notice improved energy levels, gradual weight loss, improved mood, improved cardiac and digestive tract function, and if you have a goiter, you'll notice reduction in the size of that goiter. And lower cholesterol and triglyceride levels often are seen once being treated. Interestingly enough, over 1 million people, as I said, suffer with hypothyroidism and only half are diagnosed. Older adults, especially women, are likely to develop hypothyroidism. And these symptoms are often mistaken for menopause. But when left untreated, they may result in elevated cholesterol and triglyceride levels. Now, thyroid cancer. Cancer refers to any one of a large number of diseases characterized by the development of abnormal cells. These cells divide uncontrollably and have the ability to infiltrate and destroy normal body tissue. Thyroid cancer occurs in the cells of the thyroid. Thyroid cancer is quite rare and occurs in less than 10% of thyroid nodules. You may have several thyroid nodules for several years before they are determined to be cancerous. Nearly 2/3 of the people diagnosed with thyroid cancer are between the ages of 20 to 55. And interestingly, thyroid cancer has been on the rise with a 6% increase per year since 1997. But they feel that increase is due to ultrasound technology, which has allowed for better detection of the illness. So, signs and symptoms of thyroid cancer: a lump or swelling in your neck, pain in your neck or ears, trouble swallowing, difficulty breathing, your voice may be hoarse, you have a frequent cough not related to a cold, and sometimes there are no symptoms reported at all. The most common symptom is the lump or swelling in your neck. Initially, this is often painless. You may also have constant wheezing with trouble breathing, and this is because of the swelling to the thyroid gland that actually inhibits the ability to get airflow through your bronchus. So you'll have that breathing just as if someone with asthma is having an asthma attack, same kind of thing. It's often found by your doctor with a routine exam or while testing or treating other conditions such as carotid artery disease. Common causes of thyroid cancer: radiation therapy of the head and neck, especially at a young age. Usually this is for acne, treatment for acne early in life. And scientific studies have found a genetic predisposition, not what we are born with from our parents, but when a cell's DNA is damaged by something in the environment. With that being said, most causes of thyroid cancer are unknown. Treatment options for thyroid cancer. With treatment for thyroid cancer, people generally do very well, especially when the cancer is found in the early stages, and the treatments do work well. Surgery is your primary and most effective treatment for thyroid cancer. With surgery, it just involves a small cut a few inches long across the front of your neck. Recovery is usually a week or more. Then we have radioactive iodine, which is injected after surgery to treat any remaining cancer cells. Radioactive iodine kills all remaining cancer cells with very few side effects. Most common are neck tenderness, swelling, swelling of the salivary glands, which would then cause dry mouth. There's nausea and vomiting, which is mild, and taste changes. And then we have external beam therapy, which involves aiming a high-energy beam at the cancer cells from outside the body. The side effects of this are a sore throat, pain with swallowing, dry mouth, and a hoarse voice. The radiation, like radioactive iodine, kills the cancer cells, but it can affect some of the surrounding healthy cells. It is often used alone or in combination with other therapies after removal of the thyroid. Now, chemotherapy is rarely helpful for thyroid cancer, but it does have its role with treating some cases of anaplastic thyroid cancer. And one thing to remember is after treatment or after removal of your thyroid, you will need lifelong hormonal replacement therapy. And it is good to know, however, that once your thyroid cancer is treated, it very rarely returns. Self-evaluation or prevention. Early detection is the key, and it's important to do your thyroid neck check routinely. So to do your thyroid neck check, what you're going to need is a mirror and a glass of water. You're going to want to stand in front of the mirror with your neck and focus on your neck, just above the clavicle or your collarbones and just below your Adam's apple. Look for any kind of protrusions or any kind of enlargements. Now, while you're facing the mirror, you want to tilt your head back. Then swallow a sip of water. And as you're swallowing, look at your neck. Check for bulges or protrusions in the area. If you feel that you see some kind of protrusion or enlargement, then you want to feel that area to confirm whether or not it's there. If it is present, then you want to get in to see your primary care physician immediately. Remember prevention, avoid early contact with radiation treatment if possible. And also, early detection is key, so it's important to do these checks routinely. So I hope that you all learned something today about your thyroid gland, a little about the endocrine system, and I wanted to thank you all for attending. I want to remind you that all of us health coaches are here to be a resource for you with any challenges or health concerns you may have. You can either send a secure message or give us a call. We're here to help you at all times. And I hope you had a great time and did learn something. Thank you for attending, and we'll talk again soon.